Before I begin, I would like to thank the Israeli consulate to the Southeast and our dear friends at the Curiosity Labs for hosting us. It's great being here. Thank you so much for having us. Now, you cannot have a medical conference without scaring people about cyber attacks. So let's explore into that and see what's wrong and what's going on in the cyberspace. I made a lot of information and I have a little time, so let's start running into the presentation. Albert Einstein used to say, if you keep doing the same things, you will always get the same results. Everybody uses this phrase as a meta phrase for changing. Let's speak about the changes. Let's speak about how we are still making the same things and how things never change. So we live in an amazing time, and medical devices are going through the walls, and my friends show you a lot of innovation and a lot of new things. But we have to remember just one thing. When we started doing the digital transformation a couple of years ago, we had it very, very interesting. We started communicating. We started connecting a lot of sensors and gizmos and a lot of interesting things connecting to our network. And all of them are broadcasting data and giving us big data and small data and a lot of things and a lot of analytics and cameras and so on. And it's amazing. And they're doing great stuff. But we must remember that every device we plug to the network, every device that we are plugging into the network is basically a target for a hacker. Now let's explore and see what happened in 2021. Let's speak about Medtronic. Medtronic is a company in Israel. They're a medical company and they do heart pacers. They're the best heart pacers company in the world. Well done, Medtronic. And after they're done with the heart pacers, they opened up a new division, wanted to help diabetic patients. They wanted to assist diabetic patients. And if you know diabetic patients, you know that they go around with this little bag and they have the needles and they have their insulin. And every once in a while, they need to shoot themselves with an insulin shot. Now, Medtronic wanted to make their lives better. So they evolved a new, they started and invented a new thing, insulin pump, a watch, a smart watch that has a needle in it. It has the insulin in it. You have to carry it on your hand. And when the time comes, the watch itself gives you the shot. And that is amazing. And they wanted to make life better for diabetic patients. And this is a great idea. This is a great thing. But eventually, when we want to do something good and we connect those watches, at 2021, Medtronic recalled 30,000 watches because they were vulnerable to cyber attacks. Now, think about it. They did a great thing, but a hacker that can get into the watch can stop you from getting the insulin shot that you require. Now, we've been through changes, and let's see what's waiting for us. So, AI is here. Everyone's using AI. AI is a great platform. Everyone's using it. They're using it for various things. They're using it for medical treatments. They're using it to do surgeries. Using it for so many things. And we all know them, ChatGPT and Sora and Gemini and Claude, and there's so many engines. And one thing is holding them together. And all those AI engines are powered up by moral standards. If you try to asking ChatGPT, how can I hack to a car or how can I prepare a bomb, it will not give you the answer because it has moral standards. But hackers also use AI. Now, if you take the algorithm of an AI, let's say you take ChatGPT, for example, and you go over the algorithm and you remove the moral standards from ChatGPT. And then you can ask him a lot of questions without any moral boundaries bounding him not to answer you. So we see hackers using AI. They do it to increase viruses. They do it to increase number of attacks and even to form new forms of attacks. And all of it through AI. Now let's explore some of the attacks that happened in 2024 using AI. Well, we also what happened at the United Health Group, where one of the biggest groups, Alfie and Black Hat, penetrated their organization and stole a lot of things, a lot of healthcare records, over 100 million Americans. Now, this is amazing because the damage itself is nearly $3 billion. Now, this was February. Let's go on. Let's move forward. We're going to May. Now, let's see what happened in May. In May, Ascension Healthcare, a US-based nonprofit provider, experienced a cyber attack that severely disrupted operations across its 120 hospitals. The attack led to delays in procedures and compromised patients' care. Now, a cyber attack, everybody's listening, everybody's hearing about it. They're talking about it all the time about hacking and cyber attacks. But a cyber attack on a medical device can endanger lives. This is not data stealing. This is not encryption of files. This is not bitcoins. This is endangering lives. Moving forward, let's go out of the US and let's go to Europe, London. Let's see what happened in London. London was very exciting this year. A Russian cyber gang, likely known as Quillen, executed a ransomware on Synovis. Synovis is the pathology lab service provider for the National Health Service in London. This incident caused cancellation of operations, delayed of patient treatment, and so on. And all of those things happened due to cyber attacks. Now, why does it happen? Because when we devise new technology, when we want to do something good, we never think that on the other side, on the other end of the network, there might be someone illegit who wants to use our technology to do bad stuff. And every time we connect something to the network, it's got a big X on it, calling all hackers, come in and let's see if you can attack it. And when we do it, the last thing we think about is the cyber defense. Now, at Cyber 2.0, we saw all those things happening at 2024 and even before that. And it was it was very disturbing to see that. And we decided that we wanted to do something about it. We decided that we want to evolve our technology and we want to adopt our technology to support and protect hospitals and medical devices. So let's again a little bit understand what we are doing because the way we see the cyber world is kind of different. In every given moment, in every company, in every hospital, a single computer might be penetrated by a malicious software. This happens on a daily basis in almost every company. It's not so hard to infect a single computer within the company with a malicious software. But the main damage of a cyber attack is not a single computer getting infected. The main damage of a cyber attack is once the malicious software starts spreading through the network, infecting other computers and other servers. Cyber 2.0 was built to protect against the spread of cyber attack. We realize, we understand that when a hacker targets you, he will be able to penetrate and infect a single computer. But we want to stop it there. Just like COVID-19, a single person might get the disease, but we will stop him from infecting everyone. We will stop the malicious software from spreading through the network, infecting other computers. We will stop it from sending your data to the internet, stealing all those medical records. We will stop it from downloading an encryption key or even connecting with the hacker that created it. Now, when we start exploring defense systems today, we saw that the commonly used defense system today is called EDR. EDR, by definition, means endpoint detect and response. Basically, these are commonly used solutions that work on detection prevention, meaning first you have to detect and recognize every malicious software, and then you are trying to prevent them. No matter which company you want to choose, they are doing the same thing. These guys are doing anomaly detection, and these guys are doing deep pocketing, and these guys are doing that thing. But eventually, every one of them is relied on detection, prevention. Now, what happens if you fail the detection? If you are unable to detect a computer virus, a malicious software, well, basically game over. The second thing we saw that was a problem in defense systems today was, well, if a single computer might be penetrated by a malicious software, the first thing the hacker will do is disable the defense system. Once the defense system is disabled, the hacker can do whatever he wants to. And again, we have a problem with today's defense systems, no matter who you choose. So we understand that on the detection level, we will never be able to identify all malicious software. There are just too many of them out there. So we are using the zero trust technology as basic as it comes. If I cannot detect you, if I fail the detection test, first of all, I will stop you. Then I will alert the customer, and then I will continue analyzing who you are. On the prevention level, we always take into consideration that a hacker will be able to remove Cyber 2.0 software from an infected computer. So we build our system in a way that even if a hacker removes me from an infected computer, we continue protecting the network. We are using chaos algorithm to do cyber defense. We are the only company who uses that. The system is based on 9 patents and it is quite unique. Now, basically, what we are doing, we have an agent, we have a gateway, we have a software. All depends on which assets we are willing to protect. But basically, we are monitoring all the process, all the library file, all the DLL. Everything that goes through the network, we record it, we explore it, we scan it, and we try to understand and realize which software is approved to use network resources according to company's policy, according to the hospital's policy, and any other file that is not approved to use network resources according to company's policy will never be able to do it. Now, to take it to the next level, we got ourselves certified through the medical ISO, the 27799. We got ourselves certified so we can better assist and stand through all the regulations that the hospital are bound to. And we started protecting hospitals. We started going and speaking with hospitals, and we are very well known, and we started accumulating. In India was the first place where we started working. We got Praktishka Hospital, Kim's Hospital, Care Hospital, Kingsway Hospital. In Beersheba, in Israel, we get the biggest mental institution in Israel. And it's very, very interesting because the more we come to hospitals, we see that they all suffer from the lack of cyber acknowledgement. And if you keep doing the same things, you will always get the same results. If you keep using those same old defense systems with the same old methodology, then eventually we'll get attacked. It's not a question of if, it's a question of when. And you must embrace new technologies, and you must try out something that comes with new. You must try out new technologies because the hackers are embracing every new technology that there is. They're trying everything to get into the customer, and they're shooting everything. And it's not fair because, a CTO, a CISO must succeed 100% of the time to protect your organization. A hacker needs only to succeed once. He can attack you a million times, and if one time he's successful, game over. We are searching to expand our operations now from India to the US. We are searching for medical companies, hospitals, early adopters, people who want to try and test and see new technology and protect their critical assets. Thank you so much for your time. Thank you for listening. Goodbye.